I have no idea. I get mine from France. Yeah. Do you bring it from Spain?
I didn't.
It's very simple. Okay, simple A, B, C, and you're all set. There are two different approaches. One approach is what he showed. The insertion point is right over here, and you fan it completely all over the place. Another insertion point that I like is basically an insertion point right over here. Then I can access this area, and I can turn it if I wanted to do a little bit of my nasal labia. Okay, so this is what I'm going to do right now. All right. My product of choice here, you can definitely do the ultimate, and this is what I'm going to do. I'm going to do the ultimate for you. Okay? All right?
And what's the indication here? What's the indication?
The indication is if you look at her chin, okay, it's a little bit thin. There's fat atrophy that has happened with the chin. That's why you can see a little bit of the pre-jowls right here. You can also see the mental crease that's happening right here.
It will improve all these
It
things.
will definitely improve it. Everything will go on.
Correct the angle.
The angle
is very nice.
The angle will also correct it right now. What I'm going to use is the Ultra Tape. Why? You're going to ask me why. Because if I wanted to treat her nasolabial folds and I use the Ultimate, there is a vessel that goes on very close by here. It's the angular artery. If I, any thick material, because I've seen a patient come to me who was injected by another doctor, and they've used Ultimate, UCL Ultimate, in that area, obstructed the angular artery and caused necrosis. Not because of the material, because of the injection technique. Okay, so you have to be very careful. Don't inject Ultimate into the nasolabial folds. You can inject the Ultra Deep. That's the reason why in this case we're going to do that right now.
السوية والنكروسيس مقابل للكورد.
لا هلو نديس خلاص.
نكروسيس إذا صار نكروس بعد هلو نديس.
يتلي هي يعني within 24 hours. نحن كان رثيمة شوية a little bit. It just started. هلو نديس. دوبت it. Give her hyaluronidase and disappear.
That's what I use. Or you can use the botulinum toxin syringe and go direct to the point.
Can everybody say? All right. So what we're going to do, this is the access point right over here, and I can access everywhere, all the way from here, all the way across the chin. Okay, so my insertion point is going to be right over here. Plus, at the same time, I can always a little bit raise
One of my friends say with the voice anesthesia you can do a lot of things.
How's that, didn't you?
I see the patient with tears, during the work.
Will you have an injection?
هذا ألترا ديب.
This is all about you.
5
So this you will have
No, unfortunately no. We have no
so
case.
important.
Yes, I know. We will do.
So you go the phone and later you go.
So when you do it, I will show you.
Feeling any pain?
I will
Very, very cool. Extremely cool.
You could. Yeah, you could.
but you don't go.
No. Do you see my cannula?
Always with. Yes, always with.
So it's more painful than
It's less painful. Really less painful.
adrenaline.
Ahmed, how much is the inside the Ultra Deep?
So
Malik, how many cc's is inside the Ultra Deep?
and I hold my
Ultra Deep, how many cc's? One? Looks more than this. This says like 1.2.
Ultimate or
Ultra Deep.
One.
yes.
One number.
1.2. It's 1.2. I'm telling the company it's 1.2. It's written 1.2.
European products 1.2.
لا هذه sample.
So you introduce your cannula and your
When
cannula slide because there is no
We just taught the company something.
slide until almost the other side.
Because I'm used to 1 and this is written 1.2.
Mine
Funny. It's so
where
funny.
I'm better
Funny technique, yes. See, I'm very deep here. I'm touching the bone. My cannula is not moving. I just touch the bone.
I go until I reach there. And here, I divided my lift in three. One, one, one. And so, normally, I
Sorry,
use one.
you're looking at the effect or at the ML you're
No, the effect. Never the ML. The ML is nothing for me.
The range of 1.2, I will use, for example, for this case, 4, 4, 4, 0.4, 0.4.
Yes, you can see it. You can see the difference.
If you don't do like that, you will have a big effect.
هلا دكتور. شو اخبارك؟ الحمد لله تمام. Feeling any pain?
It's a very good case actually.
Yes, but I know.
Shrinking.
Yes, also. So, I will use the global action. So, I use a 27.
So very close to the eyes, always global action.
And what I'm going to do right now, the last
You will
step,
have no pain.
is that I'm going to turn this baby, and I'm going to bring it all the way.
It's normally do deep or ultra deep.
For what? For sheep.
Feeling up,
I
you felt a
use
little bit up?
ultimate, deep or ultra deep. It
It's
depends
right over here right
if
now.
I need a lot
See it? You
or
see
not,
it?
if I need to lift a lot or not. But normally I use... so, I will use global action. What is it?
Gentlemen, global action.
Global action. Julien, tu peux avoir un global action?
We have global action here. We have the whole box.
Yes, I know. I just want one.
Global action is equal to which one of the product is deep?
The resident.
And deep is equal to what?
Perlan.
Deep. No.
Perlan. Or Sucure. You know Sucure? So I will take some
Just felt weird.
You feel it now?
Only a little bit here, that's all. Don't feel anything, no pain at all.
You have 10 years less in this salary.
Yeah, we're going to stop here.
It's bringing a truckload in for me.
Very good. I'm going to ask you to sit up a little bit so that everybody is able to see the different signs. Sit up, please.
Really one candidate.
No, never from the back. But it's still in the back.
It's 1.2.
So for me,
The box says 1.2.
we have both presentation 1 or 1.2. Yes, because you are not in a
Do you see the difference between the right and the left?
Definitely.
Yes. Normally I use safety and it's a mix of...
هذا يمكن بعدين ورا ما يقل شوي الورم والهاي تصير more soft.
Yes.
يعني اكو شوية لتنبت.
The angle has become nice. So let me look at you. I haven't seen you. Phenomenal. Let's get the mirror for her. Let her see herself.
I might cry.
Very nice.
Lovely, isn't it?
So my insertion point is going to be right over here.
That's good. So I'm going, very deep. I slide on the bone.
We cannot see it anymore.
You see it? It's gone inside very nicely. You're quite deep. You can see my cannula as I'm pushing up, but I'm still very, very deep.
So you need
Pushing up
to
very
touch
deep.
the jaw, huh? Just before.
You mean